So many times people ask me what I take as supplements, and I've mentioned 6 different things that I want people to be aware of in terms of cold and flu preparation. Well, one of the things that I personally use a fair amount of, and I'll explain why in a second, is glutathione. And glutathione has so many different properties that I could really give a long talk on that, but I want this to be specific to the cold and flu conversation because I'm trying to keep that theme. Well, some authors have actually made the statement that if you had enough glutathione, you couldn't be inflamed. I like that concept in the background of the mind because it really gives the premise as to what glutathione does for the body. It's a major fire extinguisher. And the coolest thing is that our body makes it. The bottleneck there in terms of that coolest thing is that some people don't make it very well. And you don't know who that is until you actually dive into their genetics. And so genetically, many people get hung up at certain steps of making this glutathione in the body, making our best fire extinguisher. And you know, if you go to a fire, you want to have something to put it out. And just about every day of our lives, we're experiencing inflammation. And so this is a pretty important micronutrient that people should be aware of. Fundamentally, if you've got glutamine, glycine, and cysteine on board, and that comes from our food, and you've got some of the basic minerals, things like iron, selenium, and several of the Bs, particularly B1, 2, and 3. If you have all of those things on board, theoretically your body should be able to make glutathione for you. It's predominantly made in the liver, it's recycled in the intestines, and in an ideal world it would be an eternal molecule. It'd just keep going like that and keep your inflammation under control. However, we're humans and we do dumb stuff to ourselves. We eat things that we shouldn't eat, we engage in activities excessively sometimes, and that creates inflammation. So the body is supposed to make this stuff and try and keep up with our pace. If you're genetically compromised, like I am, in terms of making and recycling glutathione, then you start to run a deficit. And when you're running a deficit in terms of inflammation, that turns into dis-ease. And you start to feel it. And it can come up any place in the body. So many people will look at those different compounds that I mentioned, so like the glutamine, the glycine, and the cysteine, and they'll say, okay, well, how can I get that out of food? And this is where the catch-22 kind of comes in. One of the best sources to get like cysteine, which is a major player in turning into glutathione, is from whey. Well, how many people do you know that are dairy intolerant or are at least aware of not managing some of the lectins? I know a lot, and maybe it's just the position that I fill here in this role, but although it's a great source to provide cysteine, some people have an immune response to that form, and so it becomes a catch-22 for them. You can take straight N-acetylcysteine, which has dual benefits to turn into glutathione, and it also has many upper respiratory clearing benefits, so helping to fight viral infections in the lungs, keeping airways open, and it turns into glutathione, kind of a twofer. Well, if you happen to be able to use that, awesome. That's a very cost-effective approach, because there's other ways that you can get glutathione into the body, and that can be kind of cost prohibitive in some ways. So like in the past, I had an IV clinic in the office, and we would do intravenous forms of glutathione, giving people up to 2-3 grams of that in a setting. And that's gangbusters, but it costs, it's time consuming, and it's not necessarily convenient. So they say, well, can I take it by mouth? Well, oral forms of glutathione historically have been very unstable and poorly absorbed. And this is what you'll read in the literature. You'll say, well, can I take oral glutathione? Well, absolutely you can, but most oral glutathione is absorbed only to about 5% in the body, so you're really wasting a lot of money on that one. About 15 years ago, when they started to stabilize some of the oral forms and they made acetylated glutathione, it really did increase the absorption value of it. So you get roughly 95% of what you stick into your mouth into the bloodstream, and the body can use that. I can corroborate that statement because I've measured it myself, I use it myself, and I've found that to be very beneficial for not only myself, but countless of my patients. The only downside to that one is the cost, but when you perceive the benefit and you start to see how much inflammation it actually controls, the value is there. So I can't overemphasize the utility of making sure that if you're going to use oral forms of glutathione, don't waste your money, make sure you're getting an acetylated form. Now there are also acetylated liposomal forms. Now this one comes in a liquid, and that one works just as well. Some folks like myself who are a little bit sulfur sensitive, and I don't know if it's more my psyche or actually the taste, but I'm not fond of the sulfur taste in my mouth, and so I go with the capsules instead. However, metabolically, they're both equally effective. There are transdermal forms. There's one that I really like that we'll use for autoimmune conditions related to the thyroid. And you can actually apply it to the skin. And if the person's complying metabolically and they're reducing their dietary triggers that are making the thyroid not work so well, you'll actually see thyroid nodules start to shrink up. And many a times they'll just go away. So you can apply glutathione topically, orally. It comes in capsule, liposomals. You can do it intravenously, and you can even nebulize it. You can actually breathe this stuff in, and that helps with lung infections. One other form is it comes in suppositories, which is a fantastic way to correct gastrointestinal inflammation. So sometimes we'll use a trio of suppositories to satisfy this need, where we'll use a little bit of ozone first, rectally in a suppository form, to counter dysbiosis and unfriendly flora there, followed by a glutathione suppository, which reduces and quenches the inflammation, kind of prepares the tissue, and then a probiotic suppository to kind of restore the flora. Works really well. So realize that glutathione, it's a super important micronutrient. It cuts inflammation. It's supposed to be made in the body. Not everybody can do that well. It's important to find out if you're in the camp that can or can't, because that really dictates some of the things that you might use as precursors to make it. Understanding your genetics opens the window to understanding your own pathways and how well you can do that. That's something that we do here at the office regularly. And realize that there's a variety of different forms that you can access. Getting your glutathione tested and getting your cysteine tested is something that I really like to have people do, because you can actually see, you can compare your genetics to what your body's doing with these compounds and how well it's getting into the cell. So that's one more thing that I like to do, because it gives you an objective look at how efficiently you can make, recycle, and use this stuff. I hope that's helpful. Realize that one of the keys to overall health and fighting infection and just being well is managing our inflammation. And glutathione is one of our most important buddies in the nutrient armamentarium that helps us to manage our inflammation. So check it out. Have a great day.